Hello, my name is Paul Thomas and I'm a family medicine doctor. That means I take care of people of all ages, from young children to older adults. I did my medical school at Wayne State University School of Medicine, and I did my residency training at Oakwood, which is now called Beaumont, over in Dearborn. I'm here to talk today because there are several problems with our healthcare system. We may even say it's broken. There's a high cost of insurance, long wait times to see your doctor, and unclear pricing. And what I want to talk about today is one potential solution that can help with these problems. A little background about myself. I started volunteering at Cass Clinic when I was about 17 years old. I've been volunteering through similar organizations over the last decade. When I was in medical school, I helped to start Street Medicine Detroit, and I also worked with the student-run free clinic. And we provided healthcare for low-income and uninsured folks throughout the city. We even built an outdoor medical clinic at the Heidelberg Project, and we called it a beacon for the broken healthcare system. And we did this because there's only about 50 primary care doctors in the city of Detroit for about 680,000 people. So that's one doctor for every 12,000 residents in the city of Detroit. This map shows that problem acutely. All of these red areas in the city mean that there are primary care shortage areas. That means there's not enough primary care doctors to take care of the people in these areas. So you may have heard that the Affordable Care Act prices are increasing throughout the state. So if you're buying an insurance plan off of the exchanges, the plan increases are astronomical, 17% this year alone. And a lot of people are struggling to keep up with these charges. So I'm going to talk a little bit about why these insurance costs are so high. So for starter, when your doctor bills you $1, your doctor doesn't actually see that dollar. It gets split off between the health insurance company and the overhead at the hospital or the clinic. So on both sides of these equations, at the insurance company at the hospital, there have to be billers and coders and lawyers who are really fighting over this $1. So your doctor's left with about 30 cents. So for a real world example, say you came in for pneumonia and your doctor billed you for $130. So that $130 would get split between the insurance company and the hospital or clinic. And your doctor would end up with about $40 for that visit. Now, that's not such a huge problem for the doctor. The doctor just sees more and more and more patients per hour. But it is a problem for you, the patient, because when you're used to getting, 30 minutes to an hour with your doctor, you're now only getting 10 or 15 minutes. It's this high-speed churn, this rush type feeling where you don't really have enough time to adequately talk about your symptoms or take care of everything. It's always pushed on to the next visit. So there's this new model for healthcare called direct primary care. And direct primary care removes these middlemen. It removes the high cost of insurance and the high cost of overhead. And so now when your doctor bills you $1, your doctor gets paid that dollar. So in our model called Plum Health, when we bill $49, we receive $48. There's a 2% credit card fee, so that's where we lose that $1. But essentially, this allows us to spend more time with the people that we want to take care of. So we typically have 30 minutes to an hour for initial visits. We have enough time to listen to you, to talk with you, and we have enough time to coordinate wholesale medications, at-cost labs, and at-cost imaging, which save you, the patient, money. We typically save people about 90% on their meds, labs, and imaging. For example, when we sell an EpiPen equivalent, the EpiPen costs $600 when you buy it from Mylan, but we can sell it for about $40. We even have enough time to make house calls because we're not so rushed. We can build this into our schedule. So this is a new model. You may not have heard of this model of care because it's so new, but it's growing across the country. There's about 500 practices in 48 states in the District of Columbia that are practicing direct primary care medicine. And it's growing because doctors are liberated. They now have enough time to spend with their patients, and patients love it too because they now have enough time to spend with their doctors. They have enough time to have all of their questions answered. This is a map of all the patients who have said, I want direct primary care, and every patient who wants this type of care is indicated by a red dot. This idea, we've been kind of pushing this out there here in the Detroit market for the last 1 year, and we recently were awarded $50,000 through the Motor City Match program because this idea will benefit Detroiters. It brings this low cost, affordable, accessible healthcare option to the city. We also participated in TechTown's Retail Boot Camp, and we were awarded $7,500 to start our practice in the city of Detroit. Again, because it's a great business model and also provides this much needed healthcare service to the city of Detroit. So the last part of what I want to talk about is I really want to inspire other physicians to follow me in this model of direct primary care for so many reasons. Mainly, there's a big social justice aspect to this and taking care of people at an affordable cost and not overcharging folks for the medical care that they need, getting them services at cost. It's very powerful. So I'll close there. If you want to reach out to me, my name is Paul Thomas. We're on the web at plumhealthdpc.com, and I look forward to answering any questions that you might have. As a little bit of a side note, I prepared this presentation for the Pechakucha event that's happening tonight, December 8th at 7 o'clock in Eastern Market. So if you're available, come out and check us out. We'll be there doing our presentation. Thank you so much for your time, and have a great day.